When they were invented 30 years ago, lasers had a popular reputation as a kind of exotic science fiction weapon that comic book heroes used to zap alien invaders. Today, fact has replaced fiction. Lasers have become weapons used by surgeons, and some of the alien invaders they zap are cancer cells and birthmarks. The Beckman Laser Institute at UC Irvine has been a pioneer in laser technology. Institute Director Michael Burns.
In the clinic, we're experimenting with lasers for the removal of birthmarks and for the treatment of infertility and for new surgical applications. In the research side, we're developing lasers for genetic engineering and for manipulation of different kinds of living cells.
The science fiction image of a laser as a kind of ray gun for making things vanish does contain an element of truth.
One of the more successful applications that we've developed here has been the use of a laser beam to remove these red birthmarks from the faces of children and adults. And the principle here is quite simple. We pick a color of the laser light that is absorbed by the red blood vessels. And when that energy is absorbed by the blood vessel, it literally destroys the blood vessel without damaging the skin that overlies the blood vessel. So in this way, we can selectively, surgically ablate the blood vessels underneath the skin and therefore literally have a removal and a fading away of this red birthmark. And that can only be done with a laser beam because of the intensity of the light that we can deliver to that birthmark in a very short period of time, so that it heats up very quickly and gets destroyed without the heat spreading to surrounding tissue and creating scarring or unsightly marks afterwards.
In addition to the surgical techniques for humans that have been developed at the Beckman Institute, researchers are working with veterinarians to pioneer new techniques for saving pets that would otherwise have little hope of surviving.
Some examples would be in the treatment of cancer. Many dogs and cats get cancers of natural causes which are very similar to the kind of cancers that humans get.
In one of these methods of cancer treatment, known as photodynamic therapy, a dye is injected into an animal and absorbed only by the cancer cells. Normal cells are not affected. The laser beam is delivered to the target area through a thin fiber optic cable beneath the skin. The laser light produces a chemical reaction in the dye that destroys the cancer cells. Institute Director of Veterinary Care George Peavy has performed several of these operations.
Utilizing this technology can offer us an opportunity both to help those animals that would not have other options for treatment, and at the same time gain information and experience from those that we think will play a major role in helping develop these modalities, these treatment methods for use and benefit of humans as well.
The success of the program has led to plans for a laser veterinary hospital, the first of its kind in the world, where experienced laser surgeons like Peavy will share their skills with community veterinarians.
Animals should be cured of cancer that would normally not be cured of cancer. Animals should be able to function better. Racehorses may be able to race better. So we actually are taking a human technology, medical technology, and improving the condition of the veterinary patients in many of the same ways. But we certainly would hope that our veterinary patients will benefit by it and will live longer and will make their owners happy.
Major funding for this program is provided by the L.K. Whittier Foundation.